Robe announcing that they have now appointed a 12-member board and the interim CEO as well, Nomkita Mngweni, outlining some of the activities that they have been undertaking since. Let's go back there.
To ensure that the food reaches the right people. The implementing partners have been selected through a 4-phase process from an initial list of over 200, compiled from multiple sources. This process involved evaluating the NPOs against multiple criteria, including their ability to meet compliance requirements, geographic footprint and networks, a proven track record of food distribution, and a capacity to implement quickly. The fund, as has been said before today, is committed to full transparency and the highest governance standards. And these principles are being applied to all the partnerships that the fund is entering into. We have ensured in the contracting that all of the Solidarity Fund's money has gone as far as is possible directly to the beneficiaries and not on intermediary distribution and overheads costs for organizations. We've implemented active daily monitoring measures to ensure efficient delivery and that the food reaches its intended beneficiaries. Thank you very much, and we look forward to engaging further.
Am I on? Hello, am I on?
Yeah. You can go ahead.
Sorry. Okay. Hi. Okay. Thanks very much for that, Gloria and the team. We'll now go into the Q&A. As I said at the beginning, what we're going to try to do is take the questions in themes, if you don't mind. So I'll take the questions in groups and give them to the team to answer, and I'll try to take them in sort of groups of 3 questions at a time. So the first few questions that have come through, we're going to deal with some questions that have to do with, for lack of a better description, I guess, governance. We've got a few questions from Ike Anastasio that fall within this area of governance. The first is, how's the Solidarity Fund dealing with corruption? Who is vetting transactions? Who is checking that companies are not inflating prices? He's also asked about procurement. How are we ensuring that middlemen aren't inflating prices around procurement, and what transparency can you provide? On a similar vein, we've got a question from Velin Tiani, who asks, how will the fund account for and ensure that funds are disbursed and used for what they are intended for? So I'm going to take that group of questions first and ask Gloria to handle them, and also field others to the team. Gloria, if we just take those questions for now.
Thank you very much, Itu. How is the Solidarity Fund dealing with corruption? Given that we are 4 weeks old, the bulk of the time was to make sure that our governance framework is in place to counter any possibility of corruption. And for that, Ernst & Young and Edward Nathan helped us to put that together. And then we have already appointed our external auditor. It is Pricewaterhouse. And 3, the delegations of authority are quite clear and they are modest vis-a-vis the amounts that have to be dispersed from the CEO and team, and then to the disbursement committee chaired by Dr. Ayanda Nzaluba, to make sure that those lines are not crossed. That makes sure that internally we can counter the corruption in whatever form it comes. On the procurement side, I will ask Jonathan to speak. I can also say that because the nature of the things that are being procured are health-related mainly, that procurement function is with a BSA, a big team there working on that. And I would like Jonathan to just explain about the vetting of the transactions and about the inflation of prices, what they see. Thank you, Jonathan.
Thank you, Gloria. Yes, if I can perhaps start just with an explanation of the Business for South Africa procurement operation. As Gloria says, this is, in a very short space of time, a very significant and well-organized operation has been set up. It consists of a large number of people working pro bono from a number of companies working full-time, together with Imperial Health Sciences, which has been appointed to undertake the logistics. So a number of steps occur in the procurement process. Firstly, there is a sophisticated web portal that's been published, and well over 4,000 suppliers from South Africa and abroad have uploaded their credentials as well as their products onto that portal. All of those go through a very rigorous validation process. So firstly, there's know your customer type of checks on those companies. We are relying on also the local trade associations such as SAMED and others to validate that these are legitimate local agencies. So there's a number of those checks that are in place. And then before any one order is placed, there is careful scrutiny both of the specifications and quality of the product, and critically also the pricing. So as I said in my earlier remarks, there has been a huge global surge in pricing for these products. We have a daily check on the range of global prices for each of the items, and thus far we've been able to procure each order at well within and often below the surge price range. So we're very confident that each order that's been placed is very much within current market norms. We're very much hoping that over the next week or two or three, global supply constraints will start to ease and the prices will come down. In terms of transparency, we certainly intend to publish the average prices at which different items have been procured, and we'll try and show how those stack up against the global benchmark prices. We are working very hard to ensure that the logistics prices are as low as possible. Some of you will be aware that air freight prices globally are astronomical at the moment, and wherever we can, we're opting for sea freight, which is far cheaper. But of course, quite a lot of the PPE has had to be brought in by plane because that's absolutely critical in terms of the urgency. So there's a significant focus on eliminating price gouging. We're working hard with local suppliers to make sure that their margins are absolutely reasonable and not out of the ordinary. Most of the surge pricing, we believe, is emerging ex-factory, in China and other countries. But we're working extremely hard to get the prices as low as possible and to ensure that there's maximum transparency.
Great.
Thank you.
Thanks, Johnny. Gloria, were you going to say something, or was that Nomkita?
No, it was me, Itumeleng, sorry. And I just wanted to add that, because there's quite a detailed, process in the BSA structures on procurement, as a fund, we've also ensured that we've got quite detailed business processes that are quite clearly mapped out in terms of what our expectations, and those reports feed back into the governance structures and our boards that Gloria was talking about.
While I've still got you, Nomkita, there was a question about what exact date will our website go live. I know you said towards the end of the week, and it's probably going to be a Monday, but I don't know if you want to address that.
Our target is to go live by this weekend. So we're trying to go live by this weekend.
Okay, great, thanks. I'm going to take a few questions on food for now. I know there are a few other health questions, and we'll come back to that, but I also want to take a few questions on food for Nicola. Nicola, a couple of questions. The first is, we've got a question asking, is there a breakdown, is there a provincial breakdown on the distribution of food question 1. Another question on food is, can you confirm the 4 solutions providers for the food distribution and confirm the process for NGOs to access that from the ground? A third question on food is, what is the organization's response to political parties that are politicking on the food campaign? There's quite a lot of food questions. I'm going to give you just one more food question, if you don't mind. Actually, let me ask you to take those to answer. A question from Mark Hayward. Is there a rapid response system to get food to communities and households where there's desperate hunger? Several of these have been identified, but the system seems to lack agility to meet their needs. In some cases, reliable NGOs require cash to purchase and deliver. So if I could ask you to just address those questions for now, Nicola.
Is that Nicola?
Yes. Nicola, we still got you.
Have we lost her? Can Jonathan?
So maybe.
I think there might be something wrong with Nicola's line.
Can Jonathan, in the meantime, be answering some more questions?
Yes.
Yes, I can.
Let's come back to that. Yep.
Yes.
Jonathan,
Okay.
there were a couple of questions. Yep.
Yes.
Go ahead.
Thanks. So, Tumeleng, if I could just add some other remarks that answer some of the questions. Firstly, I think in relation to pricing, I think it's worth reminding you all that during the same period that we have been urgently procuring equipment abroad, the rand has gone through a period of significant weakness. So that in addition to the surge in dollar prices, we've had the additional burden of having to pay more rands for each dollar. That's definitely been an issue. The second is to say that we are working hard to ensure that any valid supplier who can provide us access to good equipment at good prices is able to sell into the BSA procurement system. So working hard with all the suppliers that are part of the Black Business Council, all registered suppliers. There's no fear or favor here. Any valid supplier who can provide a good order with good equipment at a good price is being considered, and we are procuring from them. So I think that was also an important point to make. There's been a question about, has some PPE arrived in the country, and why are frontline health workers concerned? The answer is yes. Equipment is already in the country. More and more is arriving every few days. And as soon as equipment arrives, it's usually distributed out from the Imperial warehouse to the provincial depots, literally within 24 hours at the most. So equipment is getting out there, and hopefully it will soon be enough in all of the hospitals.
Okay, great. Thanks. We're going to try Nicola again. Nicola, I don't know, do you want to try answering again? Hopefully your line is better.
Yes, thank you. I hope you can hear me now.
Yes, perfect.
So the first question related to the provincial spread of our distribution, and yes, we have done allocations across all of the provinces, largely in proportion to the poor populations in those provinces have driven our allocations. As I said, our distributions were linked to mapping the most deprived wards of the country and prioritizing those, but that has given us a fair distribution across all 9 provinces. I think a second question related to the 4 NGOs, as well as I should mention the 9 implementing agents of the DSP, as well as the many other NGOs and CBOs we're working with. I am able to name the 4 NGOs, although having said that, we have been avoiding doing so in the interest of just the security in the situation. I think there is a need for the food to be secure in this time. But we have partnered with Islamic Relief, Africa Tikkun, Food Forward in this process, and the Lunchbox Fund is the fourth one. And I think that that is in addition, though, to, as I said, 9 implementing agents, as well as a very big group of CBOs and faith-based organizations. So, in fact, we have hundreds of CBOs and NGOs that form the network of distribution that is being used in this process. And those organizations are constantly in touch with the intermediaries. Sumit, was there a third question?
Can I add to this one in the meantime? Can I add to,
yes.
in the meantime?
Please go ahead, Laurie.
Yes. This part of the homework was quite detailed on our side, because as big as the implementers of food distribution are, so is the country, and it is so different in many places. You've got deep rural, you've got urban, you've got middle urban, rural kind of setup. We have taken care to make sure that the country itself, as much footprint as possible, there is, because hence you ended up having many partners, including the CBOs, who know more about what is happening in their villages and local areas and so on, just to make sure that we reach as many places as possible.
Okay, great. Thanks for that, Gloria.
There was also a question about how we are dealing with political interference in the process. And what I can assure colleagues is that we have a very active and robust monitoring process. We are receiving daily reports and accounts of the households that have received the goods and the organizations accounting for their identification of those households and the receipt of the goods by those households. So I think we are working very hard to ensure that the process is driven by the values of the Solidarity Fund and the trusted organizations that we're partnering with.
Okay. Gloria, there are 2 questions that relate in part to how we work with government, which I'm going to read out, although they're across different areas. The first question is, earlier this week, the health minister sent in a high-level team to shore up the Eastern Cape's response to COVID-19 and instructed it to conduct an audit of its PPE process. This suggests significant weakness in the province's capacity to assess its own needs. To what extent is the Solidarity Fund providing technical assistance to provincial health departments to ensure the goods procured match what is required at the front line? So while you and Johnny think about that, I would like to ask another question. This one will be going to Nicola. Would it be possible to say with which government departments the fund works? Which of these departments recommend disbursements? Are any disbursements by the Solidarity Fund done in line with BE laws and or prescriptions? Gloria, if you can just decide how you want to handle those 3 questions.
Okay, so can I start, Johnny, just talk about that, how we work with the Department of Health up to the time we procure. That will help close that gap. And then I can talk about our monitoring capacity to what extent. Just talk about how requirements come to yourself and then they end up here.
Thank you, Gloria. Yes, the Department of Health has got a process set up nationally with significant technical assistance from various technical advisors, and that provincial team, that national team is working very closely with all the provinces, and that results in a daily update on the requirements for PPE, both every day, but also projected forward. And as you would imagine, that's linked to detailed models of the epidemic itself. So there is significant technical assistance being provided through national to the provincial departments. Those requirements are coming through to Business for South Africa and to us, and all of the procurement is going in order to fulfill those projected demands. So there is quite an effective system that's in operation.
And then I think to finish off on that part, it is in our interest that the intended beneficiaries of this equipment must be the end game. That's who must receive this help. So if it is for community health workers somewhere in Ishowe or Kanduli or whatever, we would like to know that too, because that's the end game. We are going to rely probably mostly on the provincial department. That is why that relationship is very important with us in terms of what happens at the provincial level. But we are not in a position to get to that ultimate. But monitor up to the extent that we can, and working closely with these provincial departments to make sure that the intended beneficiaries of these health equipments are actually getting there. And then I think the other point I wanted to say is the correctness of the equipment. So this BSA health team is meant to make sure that we procure the right equipment. And so the whole thing of the evaluation of what's coming and not coming, we rely on that, and also Imperial Health. But the most important thing is that those things must get to the ultimate beneficiary of those things that we have procured for. That's what we had. So our monitoring capacity will work best by working closely with the provincials, at least up to the provincial level.
Okay, great. Sorry, Nikita, before I let Nicola come, please go.
Sure. I just, before Nicola comes to answer specifically, who we have partnered with, especially on the food effort, I think there was a general question in relation to, what government departments do we work with, and do they kind of influence any decisions on disbursements and so forth. I think it's important to, again, at the outset, to set the context that the fund obviously is an independent organization, and we are there to really support and augment those areas, where the state and other organs of society can't reach in a very short space of time. And therefore, by definition, that means that our partnership stretch across all of our multiple stakeholders. And those would be various government departments. I mean, that would include the Department of Health, as Johnny has spoken about. We've had to interact with the Department of Education in the context of the food crisis as well, because...
Nicola, before you talk about the food initiatives, let me throw 3 more questions for you to also deal with as you prepare for that. The first is, it seems like NGOs and charity organizations are distributing more food hampers and health items than the Solidarity Fund. Do you think the latter distributes enough food hampers to the unfortunate? So I'm not quite sure whether that question refers to do we distribute enough or whether other NGOs, but perhaps if you can just try to answer that as wholesomely as you can. And then the other question is, can transparency also talk to showing which areas have been reached so far? And I presume that's largely around food rather than health. We have evidence of children going hungry, especially those who are on feeding schemes at early childhood development centers and schools. So, Nicola, if you could just deal with those 2 as well.
Thank you. So in terms of, I think one of the earlier questions was how we have engaged with different government departments. Nomkita spoke to it more generally from a Solidarity Fund perspective. In respect of the food response in particular, as I mentioned, 25% of our food response is being delivered in partnership with the Department of Social Development through their implementing agents. But that is governed by an MOU between ourselves and the department, and as Nomkita said, we take full accountability and manage our own governance around our disbursement in respect of that partnership. And the Department of Social Development has taken responsibility for theirs. But what we have done in that particular instance is worked with their implementing agents, who we have independently contracted with and who we will independently hold accountable for the resources from the Solidarity Fund. And we will, in that instance, have worked off the DSD's lists of those households that are dependent on the CNDC centres for that food. For the remaining 75%, however, the disbursements decisions, as Nomkita said, would have been made entirely independently by the Solidarity Fund, as in all instances, and involve contracting directly with the relevant organisation. I think that hopefully that covers that question. I'm happy to entertain further questions if further clarity is required. The second question was what quantity the Solidarity Fund has distributed, and this may be a function of timing. The Solidarity Fund's distribution really got off the ground in terms of actually being received by households as of this week. By the end of today, 20,000 parcels will have been received by households across the country, across 5 of the provinces. But the remaining ramp-up will happen very rapidly, and we anticipate all 250,000 to have reached households over this next week in the month of April. And I think that at that point it will constitute an extremely large contribution to the distribution of food relative to the other food interventions that are underway. And the NGOs and CBOs are our partners in that regard. And our job is to augment and complement and support their activities. But certainly the Solidarity Fund food parcels will be a significant addition into the current environment, and there is need everywhere. In terms of the areas reached geographically, we will be able to make that available to the public. We will have a map on our website which will be updated regularly and indicate where our parcels have reached, and that will be available information. And then finally, I wanted to just return to the earlier question, I think it was from Mark Haywood, regarding whether we're pursuing a way to make more agile solutions available to smaller organizations who need more instant relief. And in that respect, we are considering and working through options around vouchers for the last phase of our food response. Over to you, Tim.
Great. No, great. Thank you for that. We've got a couple of questions, one or two questions, Nomkita, that are about our process. The first is, as you reevaluate the fund's role going forward, do you think it might be required to introduce more direct economic or job support mechanisms? That's question one. Question two is that you said the amount raised is a drop in the ocean. Do you know how much more you are likely to need? I'll let you answer those two questions for now. And I think also we might just need further clarity around the issue of what is our approach to BEE as a fund.
Okay. So thank you for those questions, Itumeleng. So I think at the outset, as we have said, as the pandemic unfolds, we will continue to evaluate, the situation and ensure that the appropriate interventions remain relevant. I think the initial phase, as Jonathan has described, has really been, especially in the health procurement space, which is really linked to how you activate an economic system. It's really been about how do you get the supplies quickly enough for you to be able to fortify your front line. And I think certainly as we have, procured stock that we think should be able to help us create buffers for at least the next 2 months, we are now starting to think about how do we optimize local manufacturing and activity, as he alluded to, which will certainly help us in creating a value chain, in unlocking a value chain in terms of the South African economy. So that's absolutely one of the things that we are discussing at the moment, because we are now at the phase where we can. in terms of our abilities. And I also think that in our procurement activities, obviously the key objective was about ensuring that we procure PPE. And actually, that has been procured from various suppliers and intermediaries who also are compliant, and some of them much broader. So we've always applied, this lens. I don't think that we've got a BEE policy in particular as a fund, because our mandate is to intervene and to be able to act and have impact immediately. But certainly in how we have procured, we have certainly seen that our supplier base is broad-based in terms of some of those suppliers being Black owned in that regard. And I also think that given the immediacy and the importance of the work that we're doing, and us ensuring that we want to be able to have as much impact and stretch the rands that we are investing, we certainly are quite clear of the fact that, in the work that we do, we cannot be able to accommodate any premiums that come with, having a particular policy and lens, because our effort is to provide a relief. And so if we go to the question of, how much do we think we need? As I said, it is a drop in the ocean indeed. And I think that the work of the Solidarity Fund needs to be looked at in conjunction with all of the other interventions that are being deployed by government and corporates and organs of society in general. And I think we have seen that the president in his speech to the country a night or so ago has activated quite a number of stimulus packages that are geared and earmarked towards, creating job opportunities and so forth. And I think that those are really going to be the meaningful initiatives that will help us in activating our economy.
Right. Thank you for that, Namkita. We have pretty much reached all of our questions. I'm just going to, I hope I have not missed any questions. According to what I can see, we have answered all the questions. There's just one or two questions that appear to be more from NGOs and people in civil society than from the media, asking about how can they work with the fund and how do they register. My understanding is that there'll be some information on the website next week, but Nicola, do you quickly want to address it? Am I correct in assuming that our website will provide indication when it goes live next week about that?
Yes, Itu, thank you. I think that is correct. We welcome offers of support and for organizations and companies to make themselves and their offerings known to the Solidarity Fund. We should stress, though, that this food intervention is it is an intervention for the month of April. It was a rapid response and isn't necessarily in the current form an ongoing program. And we aren't, as a Solidarity Fund, set up in a form to respond to general applications from non-governmental organizations. Our mandate is to identify urgent needs and to design programmatic interventions to respond to those needs, and then to form the necessary partnerships to execute against that mandate. So I just did want to clarify that issue. Thank you.
Okay.
Great. I think let me just, Gloria, I just want to double check, but from what I can see, we have no more questions coming through. So it looks like we are done. I don't know if you or any members if you want to just reaffirm anything, or if you want any members of the team to address anything they feel we may not have dealt with, but I'm going to hand over to you now.
I can just close off by saying that we hope that the crisis does create opportunity for local production. It will suit us to procure locally, So it is quite exciting that there's all manner of prototypes out there, including the SOEs, which do have pockets and pockets of highly intelligent engineers and so on who can play with these things like ventilators and also just local manufacturing on the masks and so on. It will suit us. It will be more convenient for us to source locally. For now, we are forced to go offshore and do the best we can in terms of pricing and all that kind of thing. And I think the last thing I want to say is that on the matter of transparency, when we say over 75,000 people have donated money to this fund, we owe them information. And it is a commitment from us that as frequent as possible, we will come back to South Africa and tell them what we have done with their money. Even more so, what impact have we had on managing next to what government is trying to do on the pandemic and contain it. That is how we're going to measure ourselves, but information will be placed in front of the South Africans as frequent as possible because over 75,000 people have trusted us with their hard-earned money. Thank you.
Before we close and before I thank everybody for this, just to add to what Gloria has said, for members of the media, our intention is to hold a media briefing every week. With that timing, that frequency is driven largely by our desire to be transparent. It may well be that it turns out that we don't have what we're communicating to you. You don't find as newsworthy. In which case, I think collaboratively we can decide whether we reduce that frequency. But just our immediate intentions are to hold this every week in the interest of transparency, and they'll probably be held on a Tuesday or on a Thursday, but we'll let you know about that. We've mentioned that there's work going into a website. There is obviously a website at the moment, which many of you would seen. There's work going into that website to improve its ability to act as an information portal. And I would just remind people that typically most institutions would take a few months. Most corporates would take as long as 6 months to put together a website that's robust enough to act as an information portal. This institution has not been around for a month yet, so that website, in the first instance, may still need some work, but it's our desire to be transparent, and that's why we're pushing it. I just wanted to also just clarify one quick thing before we go, which I think Nicola had tried to make the point. So the Solidarity Fund doesn't provide direct grants or relief to organizations, and it really tries to work with partners to coordinate and augment work for critical interventions. And so when you go into the website, I think just be realistic about the fact that there isn't going to be a process for every person to register to be given food grants, etc. I'd like to thank you all for your time this morning. I'd like to thank Gloria and the team for the presentations. I hope it was clear. Please reach out to us if there's any other information or clarity that you need, and we'll try to help as much as we can. And we'll continue as much as we can to also do one-on-one interviews. But I would just say that there is a tremendous amount of work that's going on, and the team has quite a lot of pressure on them. So as much as possible, we'd like to use these media briefings to talk to the media, and we won't always be able to do one-on-one interviews, but we will try our best to honor those as well. Thank you very much for your time this morning, and I hope that was helpful. That's the end.
Thank you.
Thanks.